Good evening, everyone. A very warm welcome to all the participants joining us today for the final session of the October series on learning disabilities organized by IHMA National Women's Wing. Oh, the am I audible?
Yes.
Doctor. Yeah.
Over the past few sessions, we have explored various dimensions of learning disabilities, their causes, manifestation, and management approaches. And today, we reach the most awaited and the conclusive topic treatment and homeopathic interventions for learning disabilities. I, Dr. Nivedita Rai, Dr. Rai's Homeopathy Center, Mangalore, on behalf of the organizing committee IHMA National Women's Wing, extend a warm welcome, and it gives me immense pleasure to guide you through this session that promises to blend scientific understanding with compassionate healing through homeopathy. This October month was dedicated for learning disability. It lists as we are site learning disabilities treat homeopathic interventions. Before we begin, I extend heartfelt gratitude to our previous speaker, Dr. Rekha Srinivasan, Dr. Anupa Rani, participants, and the organizing team who made this series such a success. Let's take a moment to remember our revered master, Dr. Simon Hahnemann, to whom we are forever grateful. I request the delegates, if any doubt or questions, kindly message in the chat box and it shall be addressed by ma'am towards the end of the session. Thank you. Now, to introduce our esteemed speaker for today's session, I would like to invite Dr. Archana Bhatt, IHMA Bangalore chapter, practicing in Malleshwaram, Bangalore, who will give us a brief overview of Dr. Anupa Rani Sia distinguished work and contributions. Over to you, Dr. Archana.
Thank you, Dr. Nivedita. Namaste. Good evening, all. We are pleased to welcome our speaker, Dr. Anupa Rani, an experienced homeopathic physician. She did her graduation from GHMC Calicut, PG Diploma in Management of Learning Disabilities from University of Calicut, started practicing homeopathy since 1992 and dealing with these children with learning and behavioral emotional problems since 2000. She conducted trainings for parents, professionals, teachers, and also group training for medical and paramedical sector also, for nurses, speech therapist, occupation therapist, pharmacist, psychologist, and also for Anganwadi workers and special educators from ISM department and NHM for the project Spandanam, a joint venture of ISM and Kozhikode Jilla Panchayat for 2 years. She did group training for IMA Vanita Wing of Telasiri. She has also conducted group training for IHMA Thrissur chapter. She conducted training for project Sadgamaya of Department of Homeopathy, Government of Kerala, and published articles on learning disorders, autism, behavioral emotional disorders in various journals and magazines, presented papers on the same in national and international seminars. She conducted skill developmental camps for children and also adolescents. So with this short introduction, we request Dr. Anupa Rani ma'am to take over the session. Thank you.
Thank you. Can you hear me? Can you hear me?
Yes, doctor.
Okay, thank you for introduction, Dr. Archana, and thank you for the invitation to by Dr. Nivedita. So we have been looking into what is learning disability, what are the reasons for problems to occur, and we saw.
Ma'am, excuse me, ma'am.
Yeah.
Your
Audible
Camera
now?
is not, video is not
Oh,
visible.
okay, okay. Sorry. Is it okay now? I am on my lab, but
No, ma'am, still not seen.
it's not come. But in my system, it is on.
Your voice is clear, but video is not at all.
Yeah, in my system, it is open. I have opened the video in my system.
Ma'am, try changing the slide and see.
Actually, slide is being presented by Dr. Jagadi. 1 minute. Maybe there's something wrong in the settings. 1 minute.
Or maybe leave the session and rejoin again.
Yeah, I'll leave the session and rejoin again. Yeah, maybe there's something wrong with the 1 minute.
Sorry for the inconvenience. Please
Okay.
give us
Yeah. 1 minute. I'll leave the session.
good evening. Till the glitch has been resolved, we will update you about our next sessions. We have in the November, we have few more sessions which will be conducted by Dr. Shalini on neurodevelopmental disorders and ADHD. Its understanding, its neurobiology and homeopathic management. It will be there on 4th and 11th of November. We'll expect you to join in the next sessions also.
Something has went wrong. This camera is not working. I'll do one thing. I'll join in my mobile. Okay.
Okay, ma'am.
Recording in progress.
Can you hear me now?
Yes, ma'am.
Yeah, okay. Dr. Jagani, please share the slide. Okay, today we have been talking about what is learned disability and what happens in the brain during learning, what are the deformities happening, or how it is expressed symptoms of learned disability, and why it happens. Then we have been seeing what to do other than therapeutics. Okay, now we can look into therapeutics. What common homeopathic medicines I use are given in the slide. You may be having experience of many other medicines, but these are the medicines which I use mainly. Okay, next slide. Sorry, next slide. It was some mistake was there. See the medicines I commonly use are Silesia, see, Soranum, Singamet, Lacaninum, Argentum nitricum, Calcarea fos, Calcarea carb, causticum, Natramor, Sepia, Stramonium, Lycopodium, Lachesis, phosphoric acid, Nux vomica, sulfur, Madorina, and Nux mosquita. These were the medicines I used very commonly. There are other medicines also which were used rarely, but these were the medicines I was using for again and again. Okay, there was Tarantula, then certain other medicines also. I just can't remember. Maybe while going through the cases, we can see the other medicines also. Next slide. See, we were talking about the spelling errors, isn't it? So mistakes for a word, misplacing the word, that is transposition of words. For that, Lacaninum, Natramor, Lycopodium, Stramonium, and Lachesis were used. I think the Lycopodium, Stramonium, and Lachesis, Natramor also gave very good results, especially in writing problems. And mispronounces, this pronunciation is not clear or they are slow in developing vocabulary, is causticum can be used. Causticum is very effective. And there is a history of speech delay and lack of clarity of speech, and the pronouncing is not proper. Okay, next slide. Mistakes is reversals while writing. I showed you the examples of reversals while writing. You remember the slides? How children reverses alphabets, words, and all. That is Lachesis, Lycopodium, Thuja, Calcarea fos, Natramor, and Nux mosquita. These were the medicines I used most commonly. These were taken from my case records, and I have made example of these medicines which I used. Okay, next slide. Mistakes are omitting letters. Omitting letters also, Lacanina, Lycopodium, and Nux mosquita. Omitting syllables. A syllable is completely missed. That is Chamomilla and Thuja. Next slide. Omitting words while writing the reading also, they omit words. They forget to write words. They'll write omitting all the words. And what will happen, there won't be meaning for the sentence and words are omitted. So the teachers will draw a red line underneath. See, Lacaninum, Lycopodium are repeating it again and again. Thuja and Chamomilla. Repeating words. Calcarea fos and Caninum setaivum. Transposition of words, Lycopodium and Chininum. Next. Using wrong words. That is China, Lycopodium, Nux mosquita, Calcarea fos, Calcarea carb. This Calcarea fos and Calcarea carb had helped me a lot in many cases because the metabolism, the basic problem will be the metabolism of the neurons. That is why you don't get that connectivity in the language area or the spoken area or wherever the language is used, whichever area. So this calcarea force, calcareacum and all, even natrimur, causticum and all can correct the metabolism inside the neurons. It is where the correction happens. The next, no, not next, one more thing is the mistakes in calculating Lycopodium, Naxvomica, and Medorinum. Medorinum, I think it can be used as an intercurrent also when there is a problem with mathematics in children. Whether you get an indicated medicine, you can use Medorinum as an intercurrent. This will be a good result. Next. Mistake speaking. Natrimor, Lycopodium, Singamet, Lacarina causticum is also very effective. Okay, Natrimor also is very effective in this case. Mistakes while speaking. They can't use the correct words. They'll jumble the words. The meaning won't be proper when they're talking. What they want to tell, they won't be able to express properly. In those cases, this Natrimor, Lycopodium, Singamet, and Lacarinum is very useful. And see, when we choose a medicine, we look in for the history also. Natrimor and all will have that problems with the walking. Then Lycopodium will have gastric problems. Singamet will also have history of febrile peaks like that, huh? And the history of viral diseases not being cured properly. Lacarina also. Okay, mistakes while reading. This Lycopodium and Hyoscyamus. And mistakes with spelling alone, Lycopodium and Medorinum. Just simple spelling mistakes, Lycopodium and Medorinum. Whenever you choose medicine, okay, it should be not just because I say. You look into the case, find out the indicated medicine, and you can give this Medorinum, Lycopodium and all as intercurrents. Okay, very, 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 very effective in connectivity of the neurons. Next. Okay, the next slide, please. Next set of slides, the cases taken. I have sent another set of slides. Cases I have done. This is a case one. You can see this cases. See, that is 2020. The case was done in 2020. And the child is 10 years of age. Okay, child is 10 years of age, and the father and the mother both are educated also. Both of them are educated, and the child is studying KV. And the case was referred by then Jilla Panchayat President Kanatul Jamila. She was the Jilla Panchayat President of Calicut here. Next slide. Next slide, Jagati. See how the 10 years child will be, means the child will be in 5th standard or 4th standard. Okay, see how he can write only the alphabets. English he can write only the alphabets, and mathematics, see where he is. What are the mistakes, see, in the mathematics? Just leave the slide. It's all full of mistakes, mathematics and alphabets. So this is what the child can write on his own. Okay, not what we ask the child to write or we dictate and give, or what the child can copy. These are only what he does on his own. The max problems we gave, but that English alphabets, it's because the child can write only this much. Next slide. The medicine given was tuberculum. Why tuberculum was given was because he had recurrent infections, respiratory infections, and the child was hot. I think he's very restless also. The child was very restless. See what happens this won't be a single dose, okay? This will be repeated. And in this learning disability cases, you don't get results by giving one dose, okay? If anybody tells like that, it won't happen. That's from my experience. You can't make changes just with single dose. So this was the medicine selected. and it was given for I think this must be repeated once in 2 weeks, and the child will report to us only after 1 month. Okay, once we give the remedial training, when the child is brought into a clinic, we assess the child for his informal assessment. I told you about that informal assessment in my last session. We do the informal assessment, we give the remedial training. We have a special educator also in our clinic. So she will assess the child in detail, and then give the remedial training. And if the child, they are able to bring the child every week, the child can come and take a remedial training and go back. But if the child is far away and they can't come regularly, then we give whatever remedial training to be done at home. Okay, so they should go side by side. When we give medicines, what will happen means that remedial, if we are giving remedial training alone, it will take more time. Like that, be very strenuous for parents and the special educator. And if we give medicines along with the special education, the result is much better. The result is very, very much better. That's what I think. Result is better when we give both together. We can give just homeopathy medicines and wait for the result. I think it will take more than 8 months, 8 to 9 months to get a result in learning disability. Okay, if it is a just learning disability case with no other, I mean, physical symptoms or anything, just learning disability
Yeah.
only means it take.
Excuse me, ma'am. Can you
Yeah.
increase the volume?
I increase the volume up to full. Can you hear me better now?
Okay, ma'am.
It's better? Is it better?
Yes,
Is
ma'am.
it better? Okay. So when we give the medicines, only the medicines, what will happen? It will have take more time. When we give only the remedial training, it will also take time. When both are given together, then the result will be faster. Okay, so that the children, first time they come to us, they get the diagnosis, they get the remedial training and also the medicines. And when they come back after 1 month, we can have a little bit of change. It's not very fast. Okay, it will take 2 or 3 months for us to get a result, good result. It's not that we don't get a change after 1 month, but that will be only a slight change. Okay, it will take 3, 4, 5, 6 months and all to get a palpable change. That the school teachers will say the child has improved a lot. After 4 or 5 months only, we'll get that result. It's very slow process, and you'll have to have the parent and the child and the physician should have patience to go through this, both the training and the medications. Okay. So this was repeated, I think, once in 15 days, tuberculin 1. And so you can see the result. And next slide. See the child started doing the calculations, and also see he started writing words. Though there is mistakes, but he started writing words. Then then the child will be brought again after 1 month, then 2 months, then 3 months, like that. Some children will take longer time when the parent doesn't have time to help the child, or they don't have a special educator to help the child. Then it will take more time, and that will be done only with the medicines. That parents won't be able to help. Some parents are very they help the children a lot. They'll find time to be with the child and do the corrective remedial training. Then it'll be easier. Okay, next slide. This is the case number 2. Okay, this is 7-year child. The child is studying in 2nd standard. Parents quite educated. Let's see. Next slide. See the child, when 7 years of child, he can write only this much alphabets. Just imagine, 7 years means he'll be in the mostly in the 2nd standard. They would have gone to the KG's kindergarten section, then in the 1st standard, and the child can't do even simple calculations. Next slide. He had a teething problem and also a slight developmental delay. That's why we gave calcareophos Okay. It was repeated also once in 3 weeks. This medicine was repeated once in 3 weeks. See what will happen. Next slide. See, the child started writing alphabets, and his calculations became better. He could now add, and also he started writing alphabets and few words. The child is still in follow-up. Okay, this is not the latest remedial slide. Okay, this case record, I think there is more pages in that. This photo I took some. I think it was taken some one year before, I think. This photo is new case, the new report. I think now he can write sentences also. And they changed him from CBSE school to state board school, and that made a bigger change also in him, because the state board is simpler than the CBSE board. After he changed the school, he was much better also, because it is in Kerala the state board syllabus is simpler, and the approach of teachers also, and it is a government school, they are better in approaching the children. So next slide. Next slide, please. No, this is another case. See, this again 7-year-old child. This was referred by Dr. Baburaj, and he was studying in CBSE school. Both the parents are well educated. See, next slide. The child could write only this much when he came to us. The picture on the what was written is that was in Malayalam, okay, our regional language, and the other one was English. He could write only this much. Next slide. So the next time he came, this much only. Again, next slide. Started writing words. The medicine given, I don't know whether I forgot to put the medicine, I think. What next slide? Next slide. Next slide. The medicine for this child was lycopodium, because this child had problem in testosterone. Okay, this child had problem in testosterone. Testosterone was very much less, so we gave him lycopodium. He had behavior problems also. He was very cross, very angry, very so he used to have behavior problems also. So we gave lycopodium 10 and was repeated also. And I think the child started changing after 2 months only. Slowly he started writing. Next slide. In between there was more slides, I think. One slide, this we missed. Yes, this we missed. This slide we didn't see. This case was referred by Dr. Sugadan. The child was studying in 5th standard, 11 years. Okay, next slide. 11 years child could write only this much when he came. Next. And slowly started writing words. See, the medicine was Singamet, because the child was very restless and he had history of febrile fits. And I think there was something more. He used to move his hands and legs. That's why we gave Singamet. And that's how he started writing words. And even later, he started writing sentences and paragraphs. This child had improved a lot. Next. See, he started writing sentences. We'll have to wait and ask the parent also to help the child. Not only in just reading and writing. The approach of the parent, no. I told you in the beginning also, unconditional acceptance. That's the first thing the child needs, because it is not his fault. It's not her fault that they can't read and they can't write. So we should not hurt them again and again. The school itself, they'll getting a lot of scolding from teachers, and they'll be feeling so sad that they can't read and write like other children. And when they reach home again, parents, if they start again scolding and beating the child, what's the use? The child will not want to leave even. They'll want to die. Some children also tell like this to us. I feel like when we had one child, 4 years old child, the child wanted to suicide by jumping from a stairs. See, so that much stress the child undergoes at school and home. So you have to tell the parents so that the child should have an unconditional acceptance on the parents' side. It is not that how we give unconditional acceptance. Not that we give lot of present or gift to the child, whether they achieve or not. Even if they achieve, also you don't give very what presents to big presents to the child, which are very costly. It is what is needed is a hug from you, a pat from you, and the love you can give the child, the time you can spend with the child. That is the most important thing you can give the child. The time the parent can spend with the child happily, not by scolding, not by giving punishments and all. Both of them spending time together happily, and giving an unconditional love. Mostly, what will happen is when this child has a learning problem, the parent will get irritated, they scold the child, and they won't give anything the child needs, love, even affection. They would don't, some parents won't even talk to the child. Some parents leave the child and go. We had a girl child, she was autistic. What happened is her mother left the child when she came to know the child is autistic. She left her to some other country, I think United States. And the father was left alone with the child. And father's mother, grandmother came and stayed with the father. And grandmother used to bring the child to us to our clinic. So that happens, when parents, always wants an ideal child, a child who is perfect in all areas. When there are this idealization, when that is not met, no, they'll be hurt so much, and they will first they'll start blaming themselves, then they'll start blaming the spouse, then they start blaming the spouse's family. All these things will happen in the family when they know that the child is disabled. Only later then they start scolding the child, beating the child, and whatever. One parent told us that she wanted to kill the child, so she child was autistic. So what she did was she took a pillow and pressed it on the face of the child, but luckily the child didn't die. After a second, she was awake, and she was so sad that she tried to kill her child, because it is very painful to have a disabled child. Very painful. So we have to give counseling to the parent and tell them how to deal with this child who has a problem, because they will be ashamed in front of the class, ashamed in front of their friends, being ashamed in front of their teachers. That they'll get only very less marks, few marks, even zero. So they'll be coming with full hurt and shame in their mind, reaching home. And here again, the parents started scolding them, beating them. Where will the child go? Everybody need happiness to live in this world. Happiness is one of the very most important thing. So when a child has a reading problem, writing problem, will find his strength, what his strength are, and will give training in his strength. And will also ask the parents, so if they are good at drawing, or good at painting, good at sports, or good at performance art performance, dance or music, or instruments or anything, will ask the parents to make the child perform at any place, at a residence, or in a nearby church, or in a nearby temple, or anywhere. So the winning experience, that brings lot of change to the child. Winning experience is one of the most important thing I need for this learning disabled child. So he will not be winning anywhere. It will be so bad. His self-esteem will be very low. So once when he starts winning, self-esteem will raise, and he will find out the ways to overcome his learning problem by himself. That's very one of the biggest tool we can give the child to improve himself. That's a winning experience. So while doing all this remedial training and informal assessments and all, in between we'll find out what his strength is, because there are many type of learners: a visual learner, auditory learner, and a kinesthetic learner. Visual learner is a person who remembers what he sees. Auditory learner will be a person who remembers what he hears. And the kinesthetic person will be a person who remembers what he does. So we find out what type of child whether it is auditory. We can do a assessment also in that area. Whether child is auditory, whether child is a visual learner, or whether child is a kinesthetic learner. So once we find out that, I will show the parents also how to teach the child. When he's a visual learner, we have to make the child see everything. So when he's learning about a flower, we have to show the flower to the child. We pluck a flower and show what the stamen, all that. When the child is learning about the type of different types of leaves, we'll show the child the leaves, what type of leaves are there, and root, what the child sees, he'll remember. And auditory learner means he'll hear and he will learn. So we'll make the child to record the answers, and on the previous day of exam we'll ask the child to listen to those answers again and again so that he can recollect it during the exams. And the visual learner, he has to draw and learn, he has to color, he has to underline with colors. When it is a kinesthetic learner, he has to move about and learn, he has to walk and learn, he has to do and learn, and he cannot sit in one place and learn. So we'll have to allow the child to walk about and learn, and to understand things by doing. Okay, when especially in mathematics and all, no, we'll do activities for the child to make him understand what is addition, what is subtraction. We'll make the child do activities, and it is a kinesthetic learner. Okay, so we have to find out the strength also, not just weaknesses. We have to find out the strength of the child, and we work with the strength rather than with the weaknesses. And we'll teach the parent also how this is being done, so that the parents can go home and try this method and make the child understand the concepts, especially the science, the maths, the social and EVS and all, no? To know the concepts, we have to understand what type of a learner the child is. If it is a visual learner, we can give inputs in the system also, or in the screen also. Okay, if the child is learning about the solar system, can show the videos of solar system and make the child understand what is solar system. And the auditory learner can learn in the class itself. Some children tell like that, no, I can remember whatever the teacher says in class, the child will be able to recollect. The other person, the visual learner, will have to draw and learn. Will have to color, mark. So if you want to learn an essay, you can make algorithms and learn. Then we can, while writing the exams, he can remember that a picture of that algorithm and write all the answers. So different types of learners are there, and we'll have to find out what type of learner our child is and reinforce in that way. Okay, next slide. This child is 7 years. This is this was referred by another special educator, a second standard child. Next slide. See, he can't do a simple addition. He can do only simple addition, not more than that, single digit. And let's see the alphabets. It is Malayalam alphabets are written there, and English alphabets also. See, it's only very few, not everything. Okay, next slide. And this is one of the tests we do. Draw a child to understand how much the child has grasping capacity from the environment. What child understands when we ask them to draw a child. It's a type of test we can do to see whether the child has existential intelligence, and also whether the child has attention, whether he catches information from the surroundings. Okay, this child can draw only this much. When we ask them to draw a child, this boy can draw only this much. Okay, next slide. So the medicine given was calcareous 1M. I think the child had some problem with calcium metabolism, and his calcium levels in blood was very less, and we gave calcareous 1M. And this was repeated every week, I think, every week. Next slide. See, slowly the child started understanding the human body a better. There's leg, there are hands, and he started writing the Malayalam in a better way. He started writing words, and his maths also has improved. Next slide. The child has drawing a child has improved a lot. This means he has started understanding himself, he started understanding his surroundings, he started taking cues from the environment. This is a very easy test to do, draw a child test. This is very, very easy. How much the child understand himself and the surroundings. This we can this the child will also find it will be child will be happy to draw and give rather than reading and writing. Next slide. This child was 11 years. I think the slide we saw. Next slide. No, this slide we will see. This child could write only this much. This Malayalam, what he's written. It's only a few words. Next. The child was very anxious. He had headaches. He had a vomiting in the morning before going to school. Then he had anxiety. And he used to take sweets, I think, lots of sweets. And he has got gastric problems also. That's why he gave Argenta nitricum. And again, we do repetitions, okay? When we give 2 doses, means 1 dose is divided into 2 and given the evening and next day morning. Then it will be repeated as the child, the severity of the problem and the susceptibility of the child. Maybe we'll repeat it in once a week or once in 2 weeks, even if it is 10 m, once in a month, like that. And even when we start with 1 m, then we'll go to 10 m, then 50 m. Okay, well, before we stop the medicine. Next slide. See the difference. The child started writing sentences. This must be after 3 or 4 months, okay, not just after 1 month. Malayalam also, he started writing sentences. And his vomiting reduced, his anxiety reduced, his gastric problems also got corrected. This child. Next. I think this we saw, this slide we saw, I think. Isn't it? We saw this slide. Next. This is over. So, this is how we approach a case. When we see a case, the case is brought to us. In the first thing we do is, now you can stop sharing, Dr. Jagadi. All slides are over. So, when we see a, we take send to she's there in my clinic only, and she do the assessments, then bring back the child. Then we talk to the parents how to approach the child. I talk to the child also what's the problem. They should also understand. Okay, child, you have to talk to the child in private only. Don't talk to the child in front of the parent. And when the parent is talking to you, don't allow the child to sit in your room. Usually I send the child to my special educator. Then I talk to the parents. We don't talk because the child will be heard so much. The parent will tell a lot of things, especially when child is there. They'll be blaming the child like anything. The child will get more and more hurt. Already the child is hurt. And to be brought to a doctor or a physician for a learning problem itself is a hurtful process for the child. And this parent will go on hurting the child again and again. So we don't talk to the child in front of the parent, and we don't talk to the parent in front of the child. They'll be taken in separately, and the case will also be taken like that only. First, we'll write down what the parent has to say. Then we talk to the child, and sometimes only child. If it's a small child, they won't be able to tell much. But if the child is able, some children will talk very much also. They tell a lot of things. Their pain and all they'll tell. So we take that case and then we analyze it, what to be done. After analysis, we arrive at a remedial training pattern for this child, and that will be also individualized protocol. Okay, for each child it will be different, and we do an individualized education program for the child and also a medicine both. So the case taking will take more than 1.5 hours for a child, and then giving the child a remedial training is also takes a lot of time. So we can't take in more cases on a single day. It can take only few cases. You can't do a lot of cases like that every day. So what we do is we see most of the children we see in the morning. And regular cases, fever, that type of cases will be seen in the evening only. So these children will see in the morning and afternoon. So it take that much time, and you have to take lot of effort also to be with the child. Child will, because mostly they will not want to return to us. So we have to make a relationship with the child also before the child leaves a clinic, so that the child will want to return also. Then only we can help the child, because the child, it is very difficult for the child to go through that remedial training. It will be very difficult. It will be very tiring also. His brain will have to work more and more. So it's be tiring for him. For the parent also, it be tiring. So we have to give counseling to both parent to the child before leaving them for a follow-up. So if the child comes for a follow-up, it's very good. In some cases, they won't come. They will not want to face these challenges of remedial training and all. Sometimes they won't come back. If they come back, we can bring about lots. Many have finished schooling, colleges. Many have reached many children, they have reached a what should I say, in their profession, working in various places, no? So it could help so many children in, by the time they reach 10th standard. Some children know, then they are brought in younger days, like then they are in LKG, first standard, second standard, third standard, then they would have improved a lot, then they would go back and they would never return. Then they would come back when they are in 10th or plus 1, plus 2 and all. The parent will be in doubt what to do, what higher education to give to the child. Many children are brought back to us during these adolescent days. They'll have another problem during, because it's be very difficult for them to handle their emotions during their adolescence. No, in the adolescence they'll have a lot of emotion coming from within also. So these children will have very much difficulty in managing their emotions. So we'll have to help them with that also. The children will be brought back again when they reach their 10th, 9th and all. And one thing we ask the children, when the parent also, see what mistake the child is making. Ask them to look into the answer paper where the child is going wrong. And one thing we have noticed is when the child understand what mistake he is making, he'll improve a better. His brain will understand how to correct it. So while reading, writing and all, we'll make the child, while writing especially, we'll make the child to read what he has written. Then we'll ask him whether it is correct or not. Then we'll show what is a correct spelling. Then we'll ask the child to write the spelling again by himself, and his brain will understand. So child will have to find out what the mistake is there in his writing. In the answers, what the child has, what mistakes the child is making in his answers, the child have to understand. But for exams and all, once the exams are over, when they bring back the answer papers, make the child see the correct answer in the book and what the answer the child has written. So the child understands where he is making the mistakes. Once the child's brain understands what mistakes the child is making, that brain won't repeat it again and again. Okay, because this is an intelligent brain, the learned disabled child is intelligent, they'll know how to overcome it. So first make the child aware of his mistakes, how this mistakes, why this mistake is happening, and then we'll help the child to overcome it. Okay, so it's a tedious process. We have to have very good patience to work with this children parent, and also to give the medicines also. We have to work a lot to find out the correct minimum. Sometimes we won't get that much symptoms also from this child. Okay. So if you doubt, you can ask. I think I have explained what is learning disability, how it presents, and what is the reason for those symptoms, and how we manage them, and how to assess, how to do a diagnosis, how to reach a diagnosis, and how to help the child and with medicines. Like if you need a certification, or you send the child to a psychologist. We have on-call psychologists in our clinic, and on-call speech therapists also. They can also help a lot in this in this language area. Okay, speech and language pathologists, they can also help us. So if you can have a contact with the psychologist and speech therapist, we can send them to their clinic also, refer the case and ask them to send back the case to us so that we can continue with the medicines. That also we work like that. Also we work. Some clinical psychologists, we in and around Calicut, you're in touch with them. We send a child to them for assessments and all formal assessments, and the child is sent back to us for treatment. Like that, we can have a working relationship with the speech therapist, even special educators, then psychologists, etc. Okay. If you have any doubt, you can ask.
Madam, I am Dr. Ramya.
Yeah.
I have a doubt. Like when we are giving the medicine, no? Do you see that reversals are getting corrected or the transpositions are getting corrected like that? Those particular, or do we have to chase medicines like for
Those
particular
things get corrected.
errors?
Yeah, they may be sometimes, we take case again. Once, so after 2 or 3 months, we take the case again and find out if the what medicine again, which medicines also. Lots of times, I just the example of a single medicine, but sometimes we need to change because after 2 or 3 months, we take the case again. The lot of symptoms might have removed, like physical symptoms. If there are any physical symptoms, we have to treat that first. I forgot to tell you also. Sometimes there will be hormonal problems also. We correct that, then we go in for only we go in for a these learning disability symptoms. If there are any physical problems, that one child I told you, recurrent respiratory infections, that's why we started with tuberculin. And once that all those are subsided, we take the case again, and maybe we need other medicine. We'll have to change medicines many a time. Intercurrents also we have to give. It's
So
not
when
easier.
the educators find out that there is a transposition or there is such a errors, and we can we fix to particular medicines like that? Are there specific medicines for correcting such
Not
things?
I haven't seen any specific medicines for that. We sometimes we do a lot of trials also. That's why I gave a list of long medicines. Okay, these medicines I have tried. Some we have to do a trial and error and all. It's not very easy also to find out a single medicine. I don't have any single medicine formula for any of these problems. I haven't seen any.
When we do a research, they preferably find like when such errors are coming, what type of medicine coming, like that we cannot take, right?
We can
only
tell them that which medicines will have an action nervous system, neurons. Only those types of medicines we can give. That we can select. Say causticum, calcareous force, all those medicines, the lycopodium. Those medicines are very helpful. They can take a group of medicines if you want to do a research. Can't do with a single medicine. That's not at all easy, I think.
Yeah.
It's very
Thank
difficult.
you. Because I was facing these in clinic, so I was wondering whether I am wrong or I should.
No, you are not wrong. You are correct only. You take case again and again. Like after 2 or 3 months, take the case again.
Yes.
Ma'am, there is one more question.
Yeah.
Even in some normal person, they have a tendency to do mistakes like speaking, transposition of words. Can we consider that as in physical particulars? There's a question like that.
If the person is not disabled, learning disability is not there, we can take it a particular symptom. Otherwise, if the person is learning disabled, it's a common symptom.
One more question is there, ma'am. In our practice, what kind of remedy can we advise directly to a disabled child and their parents? Some examples of exercise and behavioral therapy.
Yeah, exercise, we can do a lot of exercise. Like for the attention problem, there are a lot of exercises. Then the reversals, I can tell you brain gym. I did any of the sessions. It's called brain gym. This body midline crossing exercises. The exercise that cross midline. Even 8, when this writing 8 with your fingers and doing 8 means that's 8 is a sleeping 8, not the 8. The 8 is sleeping. We'll do it like that only.
I'm lazy 8, lazy 8.
Lazy 8, yeah, lazy 8. Lazy 8 only. That will help in. Many of the alphabets and all, transpositions and reversals and inversals and all are corrected by this exercise. You can do it with the finger. You can do it with the nose. You can do it with the eyes. And it will help a lot when they're aged persons. It will help a lot in reducing Parkinson's, Alzheimer's, and all these exercises. Midline movement, like you can do it with the tongue also. Like I can show you. You see, look. Your eyes will be this. Your eyes will be moving this side. Your tongue will be moving this side. Like midline crossing movements. Like that midline crossing movements. There are a lot midline crossing movements that will help a lot in improving your handwriting, your attention, reversals, and all.
One more question, ma'am.
Yeah.
Sphere of action of the remedies, as mentioned that the disability is because of visual or in areas of brain incomprehension. So what is the sphere of action?
The sphere of action of medicine should be in neurons. Otherwise, you don't get an action. There will be a lot of medicine that will show them, but the medicine, the mitochondria, metem of the neurons, only then will get an action of the medicines. Otherwise, you don't get an action because we have to do an synapses have to improve. The neurons have to get connected to the other neurons. All this to happen, the mitochondria has to work well. The metabolism in the cell has to be done properly. Respiration in the cell. There aren't any more questions. Thank you very much. You have been so cooperative, all of you IHMA ladies wing. I am also a member of IHMA. Still, I have to thank everybody for being so patient and for waiting for 1 month for the session to be over. Very much so helpful, so grateful to everybody. Let me do pranam to everybody of the IHMA and all the participants. They were so attentive. That's why I could present to you in a better way. Thank you, everybody.
Thank you so much, Dr. Rani, for wonderful insight and practical session with your clinical experience. Your talk beautifully bridged the understanding of learning challenges with the art and science of homeopathic healing. And thank you all the participants for your thoughtful questions and active participation. Now, to formally express our gratitude, I invite Dr. Hina Kausar, IHMA Bangalore chapter, to deliver the vote of thanks and share her words of appreciation. Over to you, Dr. Hina.
Gratitude turns ordinary movements into blessings. A very warm and pleasant evening to everyone. I'm Dr. Hina Kausar. On behalf of IHMA National Women's Wing, to extend a heartfelt word of thanks as we conclude today's enlightening session. We begin by expressing our sincere gratitude to the Almighty for His grace and blessings that have guided us throughout this event. Our deepest appreciation goes to our esteemed speaker, Dr. Anupa Rani ma'am, for her insightful and thought-provoking session on learning disability treatment interventions. Your valuable insights have truly enlightened and inspired us, ma'am. Thank you so much. We extend our heartfelt thanks to Dr. Halloween Siolho, Chairperson, and Dr. Jagati, Convener, IHMA National Women's Wing, for their unwavering support, encouragement, and guidance in ensuring the smooth conduct of today's webinar. A special note of appreciation to all the members of Women's Wing for their dedicated efforts behind the scenes, and to all the participants for your active involvement and enthusiastic support. Our sincere thanks to our Master of Ceremony, Dr. Nivedita Rai, and for anchoring today's session with grace and poise. And I thank Dr. Archana Bhatt for introducing the speaker. With gratitude in our hearts, let us continue this beautiful journey of learning, collaboration, and empowerment. Thank you once again and wish you all a pleasant evening ahead. And here's to Dr. Nivedita Rai.
Thank you, Doctor, for your warm closing words. As we wrap up this final October session of the webinar series, I want to thank our esteemed speaker, Dr. Anupa Rani, our introducer, Dr. Archana, and for vote of thanks, Dr. Hina, and of course, every participant who joined us throughout this journey. Learning disabilities can be challenging, but with awareness, empathy, and the holistic touch of homeopathy, we can make a profound difference in the lives of children and the families. Our next sessions now begin by Jalini and Kushali Gambhir. Our next session will be on number 4 Dr. Shalini on topic Bird's Eye View on neurodevelopmental disorders and ADHD, its understanding, its neurobiology and homeopathic management. Hope to see you all for the next session. Thank you once again. Till then, take care and good night.